Please. We'll now move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is for the Premier. For over 20 years, motorists have been paying for and using the Cobequid Pass, believing that once the road debts were paid off, the tolls would be gone. During that time, road usage has been higher than expected, enabling the debts to be paid off as early as 2019. That would be 7 years early, Mr. Speaker. That is good news for motorists if the government keeps up its end of the deal. So I'd like to ask the Premier if he can confirm that the tolls on the Cobequid Pass will be removed when the debt is paid off in 2019.
The Honourable Premier.
Mr. Speaker, I can confirm that when the debt is paid off, all tolls for Nova Scotians will be removed.
The Honourable Leader of the Official Opposition.
Well, Mr. Speaker, that is very interesting because the deal is that the tolls are removed for everyone, Mr. Speaker, for truck traffic, for trade, for transit, for Nova Scotians, for tourists. That's what was in the debt deal that was made in 1996 by a previous Liberal government. I heard the Premier say that all tolls will be removed when the debt is paid off. Will he confirm two things? One, that is expected to happen in 2019, and two, that it'll be for all motorists that use the Cobequid Pass.
The Honourable Premier.
Thank you, Mr. Speaker. The exact date, I don't know. It is somewhere in 2019, I believe. As the Honourable Member is very right, it has been paid down ahead of schedule. What I can confirm to him that no Nova Scotian, Mr. Speaker, and motorists will pay a toll. There's a further discussion about whether tourists will and some level of truck traffic, Mr. Speaker, but that is still an ongoing conversation. But I want to assure him and his constituents, Mr. Speaker, that they will that toll will be removed as soon as that bond is paid down, and I think it is somewhere around 2019.
The Honourable Leader of the Official Opposition.
Mr. Speaker, I'd like to thank the Premier for that answer because that is indeed good news for the Nova Scotians who are resident in Cumberland County and for all Nova Scotians that travel that busy highway, and I think they'll be happy to know that they'll be toll-free as early as 2019. That's good news. But that wasn't the whole deal, Mr. Speaker. Nowhere else in the province are people who engage in trucking or tourism expected to be charged a toll when they visit any other region of Nova Scotia. I'd like to ask the Premier if he is considering leaving the toll on for others, whether they're engaged in transport of our goods or in tourism. Why does he want to continue to treat Cumberland County residents differently than the rest of the province?
The Honourable Premier.
Thank you, Mr. Speaker. Again, I agree with the Honourable Member. Residents of Cumberland County will not, as I said that a few minutes ago, that will not apply to all Nova Scotians, unlike, quite frankly, the bridge across that people move back and forth across the harbour. All Nova Scotians pay that on a daily basis. They go back and forth. We're going to continue to work towards, is there a way to look at the piece of infrastructure that's in place? It's been a huge success, quite frankly, saved lives. We've been able to reduce the loss of life in that area. What we're looking at, Mr. Speaker, is if, from a tourist point of view and from a truck point of view, if that toll remains there, it would be to ensure that any revenue that's made from that would be to continue to improve the 100 series highways in other places, like what we see in the 104 further down towards Antigonish, or in other aspects on the 103, or in some parts of the 101.
The Honourable Leader of the New Democratic Party.
Thank you. The Premier speaks often about policy decisions being made in a way that is based on evidence. And there is all kinds of evidence against even considering the P3 option for the QE2 redevelopment project. Exhibit A, the 2015 study Purchase for Profit, which concluded that P3s in Canada's healthcare system have failed and disappointed. And Exhibit B, the 2015 report from the Centre for Policy Alternatives outlined the shortcomings of P3s. And Exhibit C, our own Auditor General's report on the Liberal P3 school fiasco. I'd like to ask the Premier, how much evidence will it take to convince him that the QE2 should absolutely not be redeveloped on a P3 basis?
The Honourable Premier.
Mr. Speaker, there's all kinds of evidence that if you believe there's only one way to do something, Mr. Speaker, you are failing taxpayers of this province. We will look at all options.
The Honourable Leader of the New Democratic Party.
Thank you. In 2014, at the request of the Premier's office, the Deputy Minister of Health prepared a report on P3s which contained an extensive list of the risks associated with this type of project. In our party, when we received a copy of this report by Freedom of Information channels, we found that the whole list of P3 risks had been entirely blacked out. So I want to ask the Premier if he'll commit to tabling this full report in this House so that everybody in Nova Scotia can see the evidence against P3 projects.
The Honourable Premier.
Mr. Speaker, there is lots of reports and evidence about P3 projects. There's also, Mr. Speaker, lots of reports when things are done in the public sector that from the cost of overruns, there's a number of things. What I think it's important for the honourable member to know, and he can communicate that to his constituents and all Nova Scotians, that this government has not made up a decision on how we will build that infrastructure. It's important for him to recognize, though, we will build that piece of infrastructure that Nova Scotians need to have in place in this province, and we'll do it, which is the best cost-effective way for the taxpayer of this province.
The Honourable Leader of the New Democratic Party.
Thank you. Along with the people of Nova Scotia, we in our party have great respect for the objective analysis that is provided by the Auditor General and his staff. Unfortunately, sometimes we receive these analyses long after decisions have been made. This was the case with this province's costly experiment with P3 schools. So I'd like to ask the Premier if he will commit to having our Auditor General review any P3 option for the redevelopment of the QE2 before proceeding with such a project.
The Honourable Premier.
Speaker, what I want to assure the honourable member is that we will continue to look at all options and how we continue to build the new healthcare facility across this province, a very issue that was ignored by that member when they were in government, Mr. Speaker. We will not be paralyzed by the opportunity given to us in Nova Scotians. We will proceed to build the kind of infrastructure they deserve, Mr. Speaker.
The Honourable Member for Cumberland North.
Mr. Speaker, my question is to the Minister of Business. It is not right for the businesses of Cumberland County to be subsidizing the 100 series highways for the rest of the province. Last year, the Minister of Business, who was formerly TIR, did a public consultation, and the feedback says, now it's definitive, quote, Nova Scotians are not interested in toll highways, but they want us to build twin highways as quickly as a capacity that we can. Why, Mr. Speaker, is it okay to leave the tolls on the highway in Cumberland County and expect the businesses of Cumberland County to pay through trucking to subsidize the highways and throughout the rest of the province?
The Honourable Minister of Business.
Again, Mr. Speaker, and I thank the member for the question. We've been very clear on this particular discussion. When the bond is paid off, the bonds, the interest, the capital required to keep that highway whole, we will do that, and we will remove the tolls for Nova Scotians, which include the members of that MLA's constituency. At that point, we'll do an assessment. We'll look at through the Department of Transportation and our team in government. We'll look at what the options are. There still will be an expensive capital and maintenance outlay for that series of highway, just like all our entire network in Nova Scotia. So, Mr. Speaker, we made a definitive decision that as soon as those bills were paid, we would remove the tolls for the Nova Scotians, and that's exactly what we'll do.
The Honourable Member for Cumberland North.
Mr. Speaker, last week the Minister of TIR informed me very clearly that he has no intentions of removing the tolls on the Cobequid Pass, even once the debt is paid, which is in contraindication to the Act, and I'll table that. It says tolls shall cease to be imposed or collected in respect to the pass once they've been paid or otherwise discharged. To the Minister of Business, you understand the cost if you're trying to grow the economy. You not only grow revenues.
Order, please. Just like to remind the Honourable Member for Cumberland North not to refer to other members of this chamber directly. The Honourable Member for Cumberland North.
We understand that if we're going to grow our economy, we not only need to grow revenues, we also have to lower the cost of doing business. It is not fair for the lobster fishermen, for the forestry industries in Cumberland County to have to pay this extra tariff and tax to ship their goods to market. To the Minister of Business, will you please treat the people of Cumberland County fairly, like the rest of the province, and remove the tolls for the business owners as well as the residents of Cumberland County?
The Honourable Minister of Business.
Thank you, Mr. Speaker. And again, with respect to this question, we're very proud, as I've said on many occasions here in the House, of our government's record for small business, with tax reduction, with red tape reduction, with the work we've done on the business environment. And certainly on our trade and export market and our trade and export work, Mr. Speaker. So we've done certainly what we could to help small and medium enterprises in that member's constituency and across the province. But furthermore, Mr. Speaker, this question about tolls is very important and what we're going to do moving forward. When the bills are paid, we're going to remove the tolls for Nova Scotians. After that, just like we've done on all of these issues, we're going to have a very public, very open conversation about what the options are. So it would be very helpful if the opposition and the Conservative Party didn't start to prejudge what's going to happen here and start to create this fear. Let's have the conversation for all Nova Scotians and we'll decide as a province.
The Honourable Leader of the New Democratic Party.
Thank you. According to CBC, offload times at the Halifax Infirmary and the Dartmouth General are falling well short of the standard established by our health department, and overcrowding in emergency rooms is creating backlogs for paramedics, some waiting hours in the receiving bay before they can transfer their patient into the care of the hospital. I would like to ask the Premier, do we not have the organizational capacity in the Nova Scotia Health Authority to do better than this in the emergency rooms in Nova Scotia?
The Honourable Premier.
Mr. Speaker, those wait times are unacceptable. They're too long, just as they were under that government, Mr. Speaker. And the Minister of Health will work with our partners to ensure that it is more acceptable, Mr. Speaker, that the high-quality paramedics that we have in this province are not tied up in an emergency room with their rigs while we're waiting to access people into our primary care system. We know it's an issue. Those wait times you refer to are unacceptable, and the Minister of Health will be charged to determine with our colleagues to make sure we deal with that issue.
The Honourable Leader of the New Democratic Party.
Thank you. Less than a month ago, I was reliably informed that the hospitals in Halifax are no longer calling code census over the intercom because administrators don't want patients and visitors hearing that the hospital's capacity is under pressure. And today, Canadian Press is reporting that the Halifax Infirmary has rewritten some wait time rules in response to the tragedy of the death of Jack Webb in an emergency room hallway earlier this year. Mr. Speaker, the blueprint for addressing this problem was set out expertly and clearly in the John Ross report of 7 years ago. So can the Premier please tell us why the recommendations of that report are being so inadequately followed that the emergency rooms of the province are in such a mess?
The Honourable Premier.
Mr. Speaker, 7 years ago, he would have been in government, Mr. Speaker. The question you might want to ask his colleagues next to him why they didn't act. Mr. Speaker, and I will say this to you, this is a very serious issue, Mr. Speaker. We are going to continue, Mr. Speaker, we're going to continue to work with our partners to ensure that the wait times that are too high.
The Honourable Premier has the floor.
Mr. Speaker, we're going to continue to work with our partners to make sure that the wait times that we believe are too high in this province, that people have access to the primary care facilities and across the province at the same time that we're doing the highly qualified paramedics and the equipment that they operate are out in our communities, responding to the needs that are happening each and every day in our communities, Mr. Speaker.
The Honourable Member for Pictou West.
Thank you, Mr. Speaker. My question through you is to the Minister of Justice. Friday, we saw the Liberal government launch an online survey regarding the legislation of marijuana. However, Mr. Speaker, this $65,000 communications exercise is really not a true consultation. Actually, Mr. Speaker, you are able to take the survey multiple of times from the same IP address, from the same device. So obviously, just those two things alone will not provide accurate results. It's too easy to manipulate. I know a bunch of teenagers that did it this weekend. Did the minister know all this before endorsing this online survey to be launched? Yes or no?
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I appreciate the question from my colleague. We believe, through the research, that the online survey is the most efficient, accessible way to source information and input from Nova Scotians. Mr. Speaker, that's the process that we've undertaken. That's the process that has worked in the past. That's the process that we've applied here.
The Honourable Member for Pictou West.
Thank you, Mr. Speaker. Actually, it's not the process that we always took in the past. We had face-to-face consultations regarding taxes, regarding twinning highways. Nova Scotians deserve that face-to-face consultations on this economic, social, justice and moral issue. They don't deserve 7 multiple questions. Will the minister agree to either hold real-time, face-to-face consultations like Nova Scotians want and deserve, or at the very least go back to square one by scrapping the current online survey that my son could have put together in 10 minutes and develop that secure and unbiased survey? Thank you.
The Honourable Minister of Justice.
Thank you, Mr. Speaker. Nova Scotians are speaking loud and clear, Mr. Speaker, on this survey. As of today, over 22,000.
Order, please. The Honourable Minister of Justice has the floor.
Thank you, Mr. Speaker. I want to remind my colleague, if my memory serves me correct, the member was fully supportive, Mr. Speaker, of the online survey when it came to the maintenance enforcement program. I don't see any difference, Mr. Speaker. We're asking for the feedback. We're asking for the feedback and input from Nova Scotians, Mr. Speaker. We'll continue along that line.
The Honourable Member for Queens Shelburne.
Mr. Speaker, my question is to the Minister of Environment. On October 5th, I asked the Minister to tell me the current preservation status of Carter's Beach and what the department plans to do before next summer. The response received was that the department has yet to compile the information received from the community meeting, which I might add, residents were very vocal with their frustrations and concerns. Can the Minister please tell me when he expects a plan to be in place that will address the concerns of residents and protect the ecosystem of the area at risk?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. I thank the member opposite for the question. As I said last time, the province is willing to engage in a conversation with the community members. To that end, there's a CLC, Community Liaison Committee, that has been set up. We're prepared to work with the municipality. There's a meeting scheduled for November, and subsequent to that, we've already committed to installing waste receptacles at the area for human waste, which was an issue there. It's protected today under the Nova Scotia Beaches Act, but there's more work to do. Thank you, Mr. Speaker.
The Honourable Member for Queens Shelburne.
Well, Mr. Speaker, this past summer there were many days that saw up to 350 people visiting Carter's Beach because of its natural beauty. While the region of Queens and municipality have responded to the many concerns of residents who are cleaning up the mess left behind by absorbing the costs of providing and pumping 2 privies 3 times a week, a washroom facility sat in inventory at the local DNR office in Milton. Can the minister reassure the people who have spent many hours and resources trying to keep the beach clean that the proper infrastructure will finally be put in place for next year's season?
The Honourable Minister of the Environment.
As I've said, we have committed to installing permanent outhouses systems if that's what the Community Liaison Committee lands on, but there will be responsibility for the municipality to operate those systems. The Nova Scotia Environment does not operate those. It's not yet a protected area. It is pending in the process to be deemed a nature reserve, but if that's what the community wants, they have to know the full implications of what that means and the limited human activity that would follow. Thank you, Mr. Speaker.
The Honourable Member for Northside Westmount.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister of Transportation. Tourism is at an all-time high in our province. More people are visiting. More people are visiting our province than over the last number of years than ever before. Good roads and clean highways are an essential part of bringing people back to our province. But over the last few years, the RIM budget for the maintenance of these roads and the sides of the roads have been cut in half. Will the Minister commit to restoring the RIM budget so our valuable transportation employees can maintain this essential asset?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and thank the member opposite for the question. The road improvement money is dedicated operational funding that is available to all non-100 series highways in Nova Scotia. And that money is allotted on a formula that takes into consideration the amount and kilometers of highway that exist in each area manager's district. So the method of distribution is very fair, Mr. Speaker, and it seems to me that brush cutting, discretionary activity for these people who can apply operational funding outside of the capital allotment is very appropriate for our province. Thank you.
The Honourable Member for Northside Westmount.
I know, Mr. Speaker, I gained a lot of territory in the last realignment, but I didn't think the roads grew that much in Cape Breton. With the lack of resources, both manpower and RIM budget, essential maintenance such as ditching, brush cutting, potholes, etc., are not getting done. This has become a safety issue, Mr. Speaker. Students and seasonal employees used to help. Staff have to be very creative in completing their tasks. And we know there's been surplus in the budgets the last year or so, we say, so why can't we use some of that money? So will I ask the Minister, will the Minister commit to seeing that there is enough staff and resources so that our staff can complete the necessary maintenance of our highways, roadways and neighbourhoods?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker. And I'd like to correct the member opposite in terms of what the money has been allocated for RIM. The RIM budget is $20 million. It was $20 million, but the third party reduced
Order,
it by 20.
The Honourable Minister of Transportation.
2010, Mr. Speaker, that budget was reduced by 25%, and this government in 2014 increased it by $1 million on top of the $10 million that we have allocated for gravel, and considering increasing that in the next budget. Thank you.
The Honourable Member for Dartmouth South. Order, please. The Honourable Member for Dartmouth South. Pardon me, Cape Breton Centre.
Mr. Speaker, during budget estimates at Province House, I asked the Minister of Health about whether a site for a new community health centre in New Waterford had been confirmed. The Minister said, and I quote, "No formal decisions as to the final location and so on have been completed, and to my knowledge those processes have not gone through and have been received and vetted and finalised." He also clearly stated final decisions haven't been made. Mr. Speaker, I'd like to ask the Minister of Health, is this still the case?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As I'd indicated during budget estimates, there's commitment indeed to work to establish a collaborative care practice in her community in New Waterford, but at that time, as is the case today, Mr. Speaker, final approvals have not been made as to a specific site location.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, on Sunday, October the 1st, I held a town hall meeting at the New Waterford Army and Navy to talk about the future of New Waterford Hospital. Over 100 residents attended and spoke out against the government's reduction of health services in Cape Breton. At this meeting, I was told by a representative from the Community Health Board that the province would break ground on a new community health centre as early as spring of 2018. Mr. Speaker, can the Minister of Health provide an update on the source of this seeming confusion between the Community Health Board and the Department of Health and Wellness?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and unfortunately at this point the member was at the meeting in question. If the member wants to provide detailed information as to whom specifically she received that information from, be happy to track it down and try to clarify where the misunderstanding is between the two. But without that additional information to work together, certainly happy to work with her to try to track down where the miscommunication is. But again, I'll reiterate, as I said in the first question, no formal finalized decisions have been made as to the location for that facility, other than to say that it will be in the New Waterford area.
The Honourable Member for Inverness.
Mr. Speaker, a question for the Minister of Health. Last year I tabled a petition calling on the provincial government to support a proposal for an expansion at the nursing home in Cheticamp at Foyer Père Fusset. Mr. Speaker, we know that some residents are sharing rooms with other residents, and in some cases sharing washrooms with up to 3 other residents. So privacy is an issue, and space is an issue for the staff who are caring for the residents, because the design is older and it's not up to the newer standards that we have now. Can the Minister provide an update on this proposal and on whether or not the government has an ability to support it?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. Indeed, there are a number of long-term care facilities across the province, Mr. Speaker, that were built and the standards in place in some cases are not the same as a brand new facility that gets built today. That would include a new build with many more private rooms and washroom facilities. The standard in days gone by, which is really more the norm than not across the province. So that would be the case, I think, that the member is describing. As far as specific timelines, I don't have them for the member today, but certainly happy to touch base with them afterwards. We can dig in and find out details.
The honourable member for Inverness.
Mr. Speaker, and the minister has referenced it, the type of accommodations varies across the province, and quite greatly in some instances. I know that it's been a while since new nursing home beds have been announced. I think the last nursing home that was announced in this province for new beds was back in 2009, so it's quite some time ago. But Mr. Speaker, I think people, especially in the Shetticamp region, the Acadian region, are looking for some indication of timeline. And because if people don't know, if people don't see anything that is coming, they start to lose hope. And they have family members living in the facility and they're concerned about them. So I'd ask the minister if he could provide some indication of timeline, if it's not weeks or months, perhaps even in terms of years, as to when this proposal might be supported.
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. As the member would know, there is an initiative ongoing within the department around our continuing care strategy. I think that process that's well underway to really look at all of our care, long-term care, home care services across the province to ensure that we have the appropriate configuration, the appropriate beds allocated, and those resources that are available to our seniors, to the people in Nova Scotia who rely on these services. So that work is ongoing, and again, as I said, I'll touch base once I dig in on that specific one for Shetticamp. Merci.
The honourable member for Cape Breton-Richmond.
Mr. Speaker, last week the Premier expressed disappointment that the Energy East pipeline was cancelled and that the pipeline would not be extended into the Strait of Canso area in the constituency of Cape Breton-Richmond. What he didn't say is that the cancellation of the project will shackle Nova Scotians to overseas oil and overseas prices indefinitely. Mr. Speaker, it's easy to be disappointed after the fact. Mr. Speaker, as much as I would like to direct this question to the Premier, my question is directed instead to the Minister of Energy. What did the Minister and the Minister's Department do to ensure that the Energy East pipeline and the jobs that inevitably would have come with it made its way to Nova Scotia?
The Honourable Minister of Energy.
Thank you, Mr. Speaker, and I do thank the member for the question. Look, this was a disappointing decision for the government. Obviously, it's a private sector investment decision that has national implications. We are always supporters of this project. We work with our sister provinces, with the national government, to try to keep this on the agenda. This would have certainly, phase one would have brought the oil to St. John, and a later phase, we were hopeful that would have came to Nova Scotia, which would have provided access to the world markets through our beautiful province. But, Mr. Speaker, that's a decision that's outside of our control, but we're doing tremendous work on our offshore oil and gas, on the idea of taking natural gas through to Nova Scotia and moving it on to international markets. So while we're disappointed, we're going to keep building on the energy file and make sure that we get all kinds of benefits from Canada's natural resources. Thank you.
The Honourable Member for Cape Breton-Richmond.
Mr. Speaker, Nova Scotians never heard this government stand up for them when it came to Energy East. Nova Scotians are not seeing this government take a public stance against the federal tax changes that are coming down the only pipe that we'll ever see. Mr. Speaker, I would like to know, why is this government so afraid of standing up in doing what's right when it comes to opposing their federal cousins?
The Honourable Premier.
Thank you, Mr. Speaker. Again, I want to thank the honourable member for the question. Mr. Speaker, I want to assure her, Mr. Speaker, that we can defend the interests of Nova Scotians. We've done so more recently when I was in Ottawa talking about the issue of tax changes. We continue to work with our sister provinces, continue to talk about how we develop resources, not only the Energy East, but how do we ensure that Newfoundland Hydro comes through our province, that we harness the Bay of Fundy, that we have access to our neighbours to the south, Mr. Speaker, when it comes to removing renewable energies into the sector. But I want to assure the honourable member, just because we don't find every microphone to yell at doesn't mean we're not out doing our job.
The honourable member for Sackville-Beaverbank.
Mr. Speaker, over the last few weeks I've been contacted by 2 different constituents about their experience when calling the provincial 211 call centre system. Each were very concerned that the responses that they were getting were actually from people on the other end of the line from out of this province. Can the minister please explain to me why our 211 system is being handled by call agents outside of this province on nights and weekends when we have very capable Nova Scotians who are looking for work and are very familiar with our province and our issues?
Who are you asking?
I'm sorry, I said for the minister.
Yeah, there's a few of us over here.
Deals with it.
Order, please. The Honourable Minister of Service, Nova Scotia.
Thank you, Mr. Speaker. That's clearly an important question. Look, in all seriousness, that is one that is very relevant to our province and to Service Nova Scotia. I'd just like to get a few further details from the member. I'd be happy to check that out. Maybe we can have a conversation after to get some of the specifics, and I'd be happy to work with him on that.
The Honourable Member for Sackville-Beaverbank.
Yes, thank you very much, Mr. Speaker. I apologize to you as well as to the minister. As a result of these concerns, I actually called the 211 line myself this weekend and just had one question for the person, which was, where are you located? The person did tell me they were in Ontario, and so I certainly look forward to meeting with the minister to address this. Thank you.
The Honourable Member for Dartmouth South.
My question is for the Minister of Health. Mr. Speaker, many people in Dartmouth are worried about the future of healthcare in their community. Before the new year, 4 local family practitioners are scheduled to retire in the Dartmouth area. Their absence will leave approximately 10,000 residents of my constituency and those of others in this House without a primary care provider. Many residents of Dartmouth are senior citizens with complex healthcare needs. They cannot use a walk-in clinic, and they cannot wait years for a new doctor to be recruited. Dartmouth also has a substantial proportion of low-income residents and other population with high medical needs. Would the Minister of Health agree that this situation is cause for alarm?
The Honourable Minister of Health.
Thank you. Thank you, Mr. Speaker. I thank the member for the question. As the member notes, her community having concerns with access to primary care. That would be the case, as I've said before, with people from across the province and communities across the province, whether it's in Cape Breton, in Dartmouth, in the HRM area, or down on the South Shore, and points in between. That's why, Mr. Speaker, we've committed to increase the resources, the investments to recruitment of primary care professionals to support our communities, provide those care services to the people of Nova Scotia to ensure they have the primary health care that they need and deserve. Thank you.
The Honourable Member for Dartmouth South.
Thank you, Mr. Speaker. I'll start by saying that it's been acknowledged by Doctors Nova Scotia and others that Dartmouth may be in the most critical situation around family physicians at this moment. So I would ask the minister just to focus on Dartmouth specifically, if we could, for a moment. Mr. Speaker, the 10,000 people I referred to are only the latest to join the ranks of those waiting for a family doctor. Already facing a doctor shortage, a wave of retirements is hitting the Dartmouth community. 33 of our 71 primary care physicians will retire within 5 years, leaving almost half of over 100,000 people in the catchment area of the Dartmouth General Hospital without a family physician. I'd like to ask the Minister of Health and Wellness, when will people in Dartmouth see new doctors?
The Honourable Minister of Health and Wellness.
Thank you. Thank you, Mr. Speaker, and thank the member for the question. As the member would know, part of the recruitment process does focus on working with physicians for those physicians to have the flexibility to choose where they practice when they come to Nova Scotia, Mr. Speaker. So we're not in a position to explicitly state when the individuals will choose. We can't provide that direction, Mr. Speaker. That process was attempted by the NSHA to provide direction and require physicians to practice in a particular location. That's been deemed not the appropriate process, so we continue to have recruiters through the NSHA on the ground working to attract physicians to sign contracts to provide services to Nova Scotians in Dartmouth, in Digby, in Cape Breton, and all points in between, Mr. Speaker, all across the province. They continue to work with physicians, nurse practitioners, and other healthcare professionals.
The Honourable Member for Dartmouth East.
Mr. Speaker, residents in Dartmouth East are concerned about the lack of emphasis on the inclusion model of education. My question is for the Minister of Education. With the hasty rollout of pre-primary, this government has focused on the early years of education. Unfortunately, students with diverse needs don't stop requiring support once they leave elementary school. In fact, Mr. Speaker, often the problems they face become larger and more entrenched. Parents of older students with diverse needs sometimes turn to homeschooling due to a lack of supports in schools. Often their voices aren't heard as their energy is spent tackling the challenges of every day instead of publicly advocating for change. My question is this, Mr. Speaker, how will this government commit to providing and improving supports for students with diverse needs from the P to 12 level? Thank you, Mr.
Minister of Education.
Thank you very much, Mr. Speaker. Of course, we start by addressing what has been the elephant in the room for a number of years in Nova Scotia, the model of inclusion that's been implemented here. We are giving that a full review. We have some notable experts coming in to assist us with that, and I expect there to be recommendations there will help us develop a blueprint to fix that system for a long time, Mr. Speaker. We've also every year increased supports for students with special needs and those needing mental health supports in our system as well.
The honourable member for Dartmouth East.
Thank you, Mr. Speaker. Mr. Speaker, the inclusion model in our province is in disrepair. By not focusing on improving inclusion now, we are doing a disservice to our students, our parents, our teachers, and program assistants. Nova Scotians have cried out for help and for change. When will this government and this minister show the leadership required to make the identified changes now to the inclusion model so that Nova Scotians have been screaming for?
The Honourable Minister of Education.
Mr. Speaker, the irony that the member suggests we rush on pre-primary, but he won't allow us to undergo the process for the Inclusion Commission to provide us with its recommendations before we move on them, I find quite compelling of the problem with that member's argument, Mr. Speaker. The fact is we have a lot of work to do in the education system. We're tackling the administrative model, we're tackling the system of inclusion, we're looking at classroom conditions, Mr. Speaker, and we're bringing forward the first new universal pre-primary program. We've got a lot of work to do, Mr. Speaker. We're not going to waste a day.
The honourable member for Pictou East. Pictou Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question for the Minister of Education. The Early Development Instrument, EDI, measures children's ability to meet age-appropriate developmental expectations of school entry. The EDI can predict how children will do in elementary school. My question to the Minister, has the Minister arranged for school personnel to complete the EDI questionnaire to be given to the pre-primary students?
The Honourable Minister of Education and Early Childhood Development.
Thank you very much, Mr. Speaker. In fact, the EDI numbers are in part used for identification for phase 1 of locations for this, where we know the need exists in our communities, and that was a key factor in terms of making that decision. Thank you.
The Honourable Member for Pictou Centre.
Mr. Speaker, the EDI measures 5 core areas of development that are known to be predictors of later health, education, and social outcomes. The EDI helps identify geographical groups of children who are vulnerable and who, without additional supports, may experience future challenges in school and to society. Will the Minister commit today to having the pre-primary children complete the Early Development Instrument, thereby allowing our children to get the best start in life?
The Honourable Minister of Education.
Finally, a member of the Conservative caucus recognizes that pre-primary is going to help our children get a better start in life, Mr. Speaker. My goodness, it's been a long time coming. I want to thank that member, and perhaps next time he stands up for someone else, they can actually clarify the position of that caucus. Thank you very much.
The Honourable Member for Colchester, Musqueam Valley.
Thank you, Mr. Speaker. My question is for the Minister of Community Services. Housing Nova Scotia has several programs in place to help people with disabilities adapt their homes to accommodate independent living with their disability. Housing Nova Scotia also offers programs for low-income persons and families to secure accessible, affordable housing. There appears to be a gap in services covering those individuals and families with disabilities who do not own their own home, but also do not fall within the low-income threshold. What programs, services, or incentives are in place that will allow this group of individuals to find accessible housing?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question, and I will be happy to go back to Housing Nova Scotia and have a chat with them to make sure that we don't have a gap there between the two. Thank you.
The Honourable Minister for Colchester, member for Colchester, Musqueam Valley.
Just a little bit more information, Mr. Speaker. I'm currently working with some constituents who fall within this gap of programming. We have called a lot of landlords in the Truro area, as many as we could think of, and those who offer some accessible apartments but didn't currently have any availability. My constituents are currently facing exorbitant costs associated with long-term rental while they search for appropriate housing. I guess, can the department help in this situation?
The Honourable Minister of Community Services.
Thank you, Mr. Speaker. I'd be most pleased to sit down with the honourable member. We'll take a look at his client's particular issue, and we will do our absolute best to help them out. Thank you.
The honourable member for Dartmouth North.
Mr. Speaker, my constituent, Sherry Dawn Barrett, is a woman who is currently awaiting gender confirmation surgery. One of the conditions of her treatment is that she lives prior to the surgery in the way that she hopes to live after it, which includes dressing in appropriate clothing. Ms. Barrett is also an ESIA recipient. When she brought a request to an ESI caseworker with a note from her doctor, she was told that the things she needed were not medical necessities, leaving Ms. Barrett's treatment in jeopardy. My question for the Minister of Health is, if gender-confirming garments are prescribed by a physician as a prerequisite treatment for gender confirmation surgery, why are they not included in the provincial formulary?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I think thank the member for bringing the question forward. Certainly, I think the role and the position of this government when it comes to supporting individuals with transgender needs is demonstrated with some legislation we brought forward previously in the previous session, Mr. Speaker, with respect to the resources that may be identified or prescribed by a physician. Unfortunately, not all services or all required materials, be they prescriptions, are covered by the formulary that are all possible items.
The honourable member for Dartmouth North.
Mr. Speaker, as I'm sure the Minister of Community Services is aware, many transgender individuals face employment discrimination on the basis of their gender identity. Those who transition later in life often find themselves suddenly economically vulnerable when employers or families are not supportive, and they might need to rely on employment supports and income assistance. In cases like my constituents, gender-confirming garments are not only necessarily for mental health and well-being, but can be an important tool for getting back on one's feet. Will the Minister of Community Services ensure that gender-confirming garments are covered under the Special Needs Allowance?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question, and I must say this is the first time this has come to my attention, and I'd be happy to sit down and take a look at that particular issue. It's never come to my attention as something that could be added to the formulary. Thank you.
The honourable member for Pictou East.
Thank you, Speaker. My question is for the Minister of Business. Last spring, I think, the government engaged Brightstar to do a study of rural internet services and try to identify where some gaps might be. I understand from estimates last week that Pictou County was in the top 2 greatest needs. So I'd like to ask the Minister, when can the people of Pictou County expect to see a plan to address some of the...
The Honourable Minister of Business.
Thank you, Mr. Speaker, and I thank the member for the question. Brightstar has conducted significant work for the province of Nova Scotia with respect to the middle mile, so that key piece of infrastructure linking major centres to some of the rural areas which are certainly a target for us in our broadband initiatives. Now we're in that last mile piece as well, so we re-engaged Brightstar to do an additional component of this study, so that once we knew how we would get the fibre op or the satellite technology into rural areas, how we would actually actually connect them to the home. So the member is right. There certainly is a focal point around Pictou and a few specific areas in the province, and we're going to count on Bright Star to give us that information. Again, as we said in estimates in question period last week, Nova Scotia is really punching above its weight in terms of commitment to the broadband issue and making sure that we're connecting Nova Scotians, with $14.5 million coming this year, lots of money leveraged from the feds, and many more dollars to come.
The honourable member for Pictou East.
Thank the Minister for the answer. So we're waiting for a second phase, I think, a second phase report for the last mile. I wonder when that report might be expected. And also when people at Pictou County and all of Nova Scotia, rural Nova Scotia, can expect to see actual work on filling the need that's there.
The Honourable Minister of Business.
Thank you, Mr. Speaker. I believe the final phase of the Bright Star report is going to be somewhere around mid-fall. However, really, that's going to be important information and detail. There's no doubt about it. But at the end of the day, I think from a departmental perspective, certainly from a government perspective, we understand that there's a lot of work to do. So the money that we have allocated for broadband, $14.5 million, the hundreds of millions that's going to be allocated through the federal program that will certainly do a lot to leverage the municipal projects that we have across the province, which municipalities are certainly taking a lead on their specific needs. All of those things are happening now, so we don't have to wait for that report to have final details on what the plan is going to be. We're going to put together a structure here and spend that money as soon as we can, but at the end of the day, those plans are ongoing, and we've got to get that money on the ground as soon as possible so that we connect more and more Nova Scotians with every dollar that we invest. Thanks.
The honourable member for Kings North.
Mr. Speaker, my question is for the Minister of Labour and Advanced Education. Mr. Speaker, my constituent Emily was told last year she did not qualify for a student loan. The only reason given from the Student Loan Centre was that it was an online course and they didn't offer loans for strictly online courses. If Emily had one class in an actual building, they could have offered a loan, but since every class was online, she had no options for a student loan. My question for the Minister, Mr. Speaker, is this correct? No student loans for strictly online courses?
The Honourable Minister of Advanced Education.
Thank you, Mr. Speaker. Yes, that is correct, that our student loan program is for in courses in institutions in Nova Scotia. Thank you, Mr. Speaker.
The Honourable Member for Kings North.
Mr. Speaker, this was for an early childhood education course at NSCC. My constituent called in May of this year before she applied because she wanted to know if online courses were considered full-time or part-time. That's when she was told online studies didn't qualify for student loans and there was no point in applying. My question for the Minister is, when will this be fixed, given that in this day and age online courses have become more significant in our lives? This government offers recognizes online courses for teachers who upgrade to a master's. When will this be fixed?
The Honourable Minister of Labour and Advanced Education.
Thank you, Mr. Speaker. I don't know if this is something that needs to be fixed, but I'm certainly more than willing to look at it, and if the member would like to share with me the details of the case, I'll look at it into the department, and it might be something that, you know, with budgeting pressures in the future, if they allow, for us to take a look at it and allow funding for online courses. Thank you, Mr. Speaker.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. You know, on May 1st, 1949, over 100 automobiles were the first cars to cross the Cape Island Causeway. It was a $600,000 causeway built 68 years ago, who has seen lots of changes in our world. Currently, what's happening to the Cape Island Causeway, there seems to be a bit of subsidence happening. There's a couple of bumps in the road, and the constituents of Cape Island are concerned that the bridge or the causeway might be falling into disrepair. So my first question to the Minister of Transportation is he aware of the issue, and what might be the remediation for the Cape Island Causeway?
The Honourable Minister of Transportation.
Mr. Chairman, thank you and thank the member opposite for bringing that to my attention. I have to say it's not been surfaced to me. However, I can tell you that we have a great commitment in our highway system to our rural areas, and recognizing the nature of our province, connected by ferries, connected by causeways, we are committed to making sure that these accesses and avenues are kept in good repair.
The Honourable House Leader for the Official Opposition.
Well, I can tell you, Mr. Speaker, I'm sure the people of Cape Island wouldn't want to be going back to a ferry, but you know, right now the question is, and actually I do know some of the answer to it, is that the department right now is looking at ways to sort of map what's going on in the causeway without having to dig holes or move things out of the way. So maybe, if I may impart upon the minister, that they do that as quickly as they can and basically pave and fix what already has a bump in it to at least alleviate and communicate with the residents of Cape Sable Island.
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and thank you, Member Opposite. I'd be more than happy to investigate this more fully and get back to you on what our solution might be. Thank you.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, this spring the Public Service Commission conducted a survey of all government employees. These hard-working people develop and implement the programs and services Nova Scotians depend on. Yet only 46% of these employees said they feel valued by the Government of Nova Scotia. Mr. Speaker, my question is for the Minister responsible for the Public Service Commission. Does this Minister agree that the actions of this government have left government employees feeling undervalued?
The Honourable Minister of the Public Service Commission.
Thank you, Mr. Speaker, and thank you for the question. The answer is no. And we as a government have been working very hard to support and make sure that all our public servants are respected, felt comfortable, and seen to work in an environment that they enjoy. Thank you.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, in the same survey, one area of concern across all departments was senior leadership. Only 36% of employees think senior leadership makes timely decisions.
Order, please. Time allotted for oral questions put by members to ministers have expired.